When we hear the word epidemic, we expect a spectacle. We picture sudden, chaotic events that disrupt daily life, overwhelm hospitals, and command immediate, urgent headlines. We operate on a basic assumption about public health. If a threat is massive and affecting millions of people, it will naturally be impossible to ignore. Yet right now, there is a global condition actively affecting roughly half the population, bypassing our standard rules for how a crisis is supposed to look and behave. That condition is vitamin D deficiency. If a physical deficit has spread widely enough to reach genuine epidemic proportions, how does it manage to stay entirely off the public's radar? This suggests a gap in how we identify danger. We have built systems to respond to loud, sudden disruptions, while a quiet, widespread deficit creates no immediate alarm. To categorize a health issue as an epidemic, epidemiologists look for a sudden increase in cases far above what is normally expected in a given population. This diagram illustrates the global population. Current estimates show that over 1 billion people worldwide have inadequate levels of vitamin D in their blood. In North America, Asia, and Europe, and across every demographic from children to the elderly, the rates of deficiency remain consistently high. Geographic location and age offer little protection from this trend. To put that scale into perspective, compare those numbers to a highly visible, highly disruptive annual event like the seasonal flu, which typically affects about 1 billion people worldwide. The vitamin D deficit matches or exceeds that massive footprint, entirely undetected. This volume is driven by a rapid change in human behavior. Over the last century, we transitioned almost entirely to an indoor, screen-based, climate-controlled existence, cutting ourselves off from our primary source of vitamin D, the sun. The raw data identifies vitamin D deficiency as a condition that has reached a level of global saturation rarely seen in clinical medicine. But scale alone doesn't explain the silence. How can 1 billion human bodies operate with a fundamental deficit without noticing it? Think about the mechanics of an acute infection. A virus enters the body, multiplies rapidly, and the immune system launches a counterattack. That battle creates immediate, flashing physiological alarms, high fevers, swelling, and severe pain. This graph illustrates the difference between an infection and a deficiency. An infection causes a sudden spike that crosses your body's red alarm threshold. A deficiency is a slow, gradual depletion over years. It never trips those acute biological alarms. Instead of a high fever, you get mild fatigue. Instead of sharp pain, you experience a persistently low mood, brain fog, or muscle weakness. These are vague, diffuse signals that we naturally write off as the side effects of a busy, modern life. This creates what is known as a baseline shift. When millions of people around you share the exact same low energy and chronic fatigue, that compromised state of health stops looking like a problem and simply becomes the accepted normal. Our modern medical triage system is designed to catch the sharp spikes. It prioritizes acute symptoms and immediate trauma, which means a condition entirely hidden within a shifting baseline will easily slip past standard checkups. The very fact that this deficiency is so common provides its perfect camouflage. We overlook it precisely because everyone is experiencing it together. The core premise of the source text is that managing a silent epidemic requires shifting our health strategy from reacting to symptoms to monitoring our baseline levels. Waiting for a loud, disruptive symptom to tell you something is wrong is a flawed strategy for long-term health. By the time a chronic deficit creates acute pain, years of optimal function have already been lost. The first step to fixing the problem is acknowledging that an invisible deficit can exist in your body right now, regardless of how normal you feel. Unlike battling a complex, mutating viral infection, resolving the vitamin D epidemic doesn't require a breakthrough in medical technology. It only requires a simple blood test, proactive awareness, and time outdoors. There is a cascade effect here. When you identify and correct a hidden deficiency, you break the illusion of that lowered baseline for yourself, revealing how much better your body is actually supposed to feel. The only way to defeat a silent health epidemic is to stop waiting for it to announce itself and finally give it a voice.